You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Dr. Shula Green, an associate professor at UCLA and licensed clinical psychologist specializing in autism, sensory processing, and neurodevelopmental conditions. She leads the UCLA Scan Lab, where her research focuses on how the brain processes sensory information during adolescence. Today, we'll discuss her findings and how they're shaping new interventions. Welcome to the podcast, Dr. Shula Green.
Thank you for having me.
Well, I'm excited to talk with you about this. It feels like research is coming out all the time that's guiding the field, and it's something that if we're not staying on top of, I feel like we're falling back years and years as far as what we can apply for treatment. But before we go there, oftentimes people have such interesting paths on what led them to either the interest or the practice or the research. I'd love to hear your story of, how you found the field of autism and sensory processing.
Absolutely. So I think there were two main things that led me to this place. The first one is back in the early 2000s, I read a book by Temple Grandin, who some of you may have heard of. She is an autistic woman who has a doctoral degree and has done incredible things with animal science, but has also written very articulately about her experience having autism and what it is like to be autistic. So I read her book, A Cow's Eye View, back in the early 2000s. And, you have to think back to this time. This is a time when autism was not well understood. It was very stigmatized. People thought that autism was a disorder of social interest and social motivation. They thought autistic people had no interest in interacting socially. And Temple Grandin put a completely different spin on it. She described her experience as a child of having a just very different sensory experience than other people around her, that she was completely flooded and overwhelmed by sounds, by touch, and then that sensory experience caused her to withdraw, to, have kind of repetitive calming behaviors, to want to be in a corner or something, remove herself. And again, as a kind of college student in the early 2000s, I was blown away by this. Nobody was talking about this. I thought this was, incredible. Like, wait a second, she's saying that it's not that she doesn't want to interact socially, it's that she can't because she's so overwhelmed by these sensory experiences. And I read this in the early 2000s, but she wrote this in 1995. So, that's how many 30 years ago she was telling us this, and I don't think anybody was really listening. So that blew me away. And then I knew I wanted to work with kids and do research on child development. And I applied to lots of jobs, and I ended up getting this fantastic job at Boston University with Helen Tager-Flussberg and Alice Carter doing autism research. And we were doing 3 to 4 hour long assessments with 2 and 3-year-olds with autism. So you can imagine if you've ever been with a 2 or 3-year-old of any type, trying to get them to do anything is very hard.
Absolutely.
And the way we got them through these assessments, I think, was that my direct supervisor was an occupational therapist. So she had all of this expertise in how to shape the environment to help kids be successful. What kind of chair do they need to sit in? We had different tables, different chairs, weighted vests, just really how can we set up our environment to be easier for these little kiddos to do all these hard things we're asking of them. So I think I was almost brought up with this framework of sensory environment is important. And then when I got to grad school and really started studying psychology, I was very surprised to find that nobody else was thinking about this. Yep. Really, like neuroscientists, psychologists, sensory experiences, sensory reactivity was not part of the literature. It wasn't part of the field. We were still in this idea of autism is a social communication disorder. And that was really the thinking back then, again, like mid to late 2000s. And that actually really excited me. I thought, wow, here's this kind of wide open area. Why is nobody else thinking about this or looking at it? I thought that was really cool. So I decided that's what I wanted to study in grad school. And in some ways, I got very lucky because in 2013, the diagnostic criteria for autism changed and sensory processing differences were added
Yep.
to the criteria for the diagnosis. So all of a sudden, people were getting very interested
Hmm.
in sensory processing. And I was really in a great position already studying it to kind of move that area forward in science.
Yeah, and I mean, with that is prior to that time when it became part of the diagnostic criterion and something that people were actually evaluating, the research probably wasn't there. The funding for the research was probably harder to find. So I'm so glad that that opened up the possibility to kind of say, hey, you know what? Let's look at all of the components. Let's really dive deep because it's going to inform so much on how to empower people as if you could really understand how they're experiencing the world around them. I love the fact that you brought up Temple Grandin through this because I think that her voice probably when you look at the tail end of, I'm looking at sensory processing and getting the research and putting it out there to understand adolescence, young adulthood, without hearing her voice and having others feel comfortable sharing their experience, these research questions might not have come to fruition. But let's talk a little bit about sensory processing, because I don't know that everybody really understands what that term means or how it might affect somebody's daily life. But can you give us some background and maybe also how that might affect adolescence and the way that people are trying to navigate such a difficult time period of their life, and how sensory processing might affect some of those critical timepieces?
Absolutely. Again, something I get really excited about when I start thinking about it because it's so we just go about our daily life usually not always thinking about kind of how our brain processes sensory information, but it's pretty amazing. So our brain is this incredible filter. And it filters out a lot of the sensory information in our environment without us even having to think about it. But if you really stop and think at any given moment how much sensory information is coming into your brain, it's kind of incredible. Like really think about it for a second, the feeling of all the clothes that you're wearing on all the different parts of your body, your shoes and socks, the chair you're sitting in, maybe there's a truck driving by, there's a clock ticking, the air conditioning humming, all of the lights and kind of the visual signals coming into your brain. It's like thousands and thousands and thousands of pieces of sensory information.
Is that
Yeah.
honestly, as I feel like I'm becoming overwhelmed because now I'm thinking about what's going on in
Yes.
my environment around me. So I could definitely
But if
hear
you
and
start
see what
thinking
you're
about
talking
it, right,
about.
you're like, whoa, that's
Yep.
that's way too much.
Mm-hmm.
But we don't think about it all the time. And the reason that you don't is because of this amazing filtering that our brain does completely subconsciously. So you often will, when a signal starts coming in for the first time, say you sit down in your chair. You do feel your chair when you sit down in it, but after you've been sitting there for a little while, your brain stops paying attention, and that's called habituation. That's when the sensory signal keeps coming in the same way. Our brain kind of says, hey, that's not important anymore. I've already experienced that. We're done with that. It's not a threat. It's not important. Let's move on to something else. But it's all subconscious. We don't really think about it. But just imagine for a second what it would be like if your brain kept paying attention to all of those sensory signals all the time. And that's what we think might be going on for people who have autism or other types of sensory processing disorders or challenges, that there's something a little bit different about that filtering system in the brain so that you're just experiencing everything all the time. And autistic people will say things like, oh, it feels like my brain is on fire, or it's like so overwhelming, it's information overload. And that makes so much sense. A true difference in how their brain is processing sensory information. And you asked about adolescence. Do you want to hear more about why adolescence is a particularly important time for this, or are there
Well,
other
let's
directions?
kind of go back a step first, because as you were
Yeah.
describing that, all I'm thinking about is, okay, so this development is starting early. The ability to be
Yes.
able to kind of
Yes.
filter is something that we need from day one in our lives, or else it's
Yes.
going to be so overwhelming. So maybe we can go backwards a little bit and kind of go through the development process of, what's happening during early childhood, what's happening during late childhood through adolescence, and what steps are in place to help create these, I'd say, skill sets or the abilities or the understanding to be able to know how to filter out things or how to create ways to be able to cope with the fact that the filter might not be there or as strong as somebody else's filter.
Sure. I know. I think you're absolutely right. You have to go way back to the beginning of development to understand what's happening. So let's go all the way back to newborn stage. So imagine a newborn baby, completely new to this world, coming out, into the world for the first time. And newborns don't have great sensory filters. I'm oversimplifying this, but they really are highly affected by all of this sensory information. And if you've ever had a newborn or interacted with a baby, they need a lot of help managing those their sensory environment. They need to be swaddled, they need to be rocked. Little things like wind blowing on their face could really bother them. You spend a lot of time as a parent kind of helping your baby cope with their sensory environment and doing a lot for them because they can't do it themselves yet. And even when you look at typically developing toddlers, they're really picky about their sensory environment. They're picky about, what clothes they wear. They're picky about what types of food they like. If you've ever tried to potty train a toddler and you've tried to take them to a public restroom, you probably know how challenging it is because they often are really afraid of the hand dryer or the toilet flushing. A lot of toddlers are picky about the feeling of sand or grass or things like that. So there is this kind of typical developmental period where it's kind of normal to have a lot of reactions to different sensory things and not really know how to, we call it regulation, which means like, how do you as a person kind of calm yourself or cope with these sensory signals? Toddlers aren't great at that, and newborns are terrible at it. But if you start interacting with 8, 9, 10-year-olds, you'll probably notice it's a lot better. You can take them to a public restroom and it's okay. Food pickiness really starts going down. Kids get less picky about kind of the feeling of different clothes on their body. They get better at filtering out things and being able to attend to a person talking with background noise.
Mm-hmm.
Now, we don't know why that is yet. We don't 100% know why that is. We don't have the brain science yet for me to tell you exactly what is happening between the newborn stage and the 10-year-old stage to change that. But something is changing. So what that means is there is some typical development that happens between newborn and age 10 that changes how we process sensory information, where this filtering system develops. You're not born with it, is the point. I don't think you're born with it. I think it develops over time. And I think it develops during childhood, typically.
Is that part of the research that you all are doing at the Scan Lab? Are you looking more towards what happens after that period of development and how to be able to kind of create paths forward so that you can kind of build back some of those coping mechanisms or ways to be able to regulate in the environment that's oftentimes so chaotic?
So our research has started around age 8. Okay. And a lot of that is practical because we do brain imaging research with an MRI scanner. And that's kind of a big magnet. It's not invasive. It's like a big tube. and you go inside it, and it makes a loud noise, and it kind of takes pictures of your brain. But in order for it to get good pictures, you have to be completely still. If you move your head at all, the pictures do not come out while they're fuzzy. So kids have to be old enough that we can train them to stay still, and that usually happens around age 8, is around 7 or 8 is the youngest that we can easily do it for our types of sensory processing studies that we're doing. However, I have some fantastic colleagues who are studying kids younger. So I've worked with Dr. Morella DiPreto at UCLA, and together we have done some studies in infants as young as 6 weeks old. And why can you study infants when you can't study 5-year-olds? Well, you can actually put babies in the MRI scanner when they're in natural sleep. And so they do stay still then because they're sleeping. So that allows us to get these scans on babies. So we have a little bit of information on sensory processing in babies. And then my colleague, Dr. Grace Baranek at USC, actually has done some lovely longitudinal research in childhood, not brain research, but just showing kind of how sensory reactivity develops differently in autistic children and typically developing children.
Absolutely.
Yeah.
So there is this gap period, which obviously is kind of the next research question after everybody's able to kind of piece together the areas where maybe the technology has caught up. But the nervous system and the brain are so complex, and so are every one of our self-regulatory techniques and coping mechanisms, is that they're all different. Like the way I might be able to regulate with an environment might be very different to the way that you would, as would the triggers within the environment, what's going to kind of hit me and affect me more. What is it that you are seeing in the MRIs for adolescents that's relatively common for, I guess, those that identify autistic?
Yeah, so one of the things we're seeing is that their brains are just reacting more strongly to sensory stimulation in general. And how strongly your brain reacts correlates with how much sensory over-responsivity you have. So the point there being that not every autistic person is the same. We all know that. There's so much variability in sensory responsiveness and sensory reactivity. So we don't want to just look at autism as one big group. We do try to look at kind of how these brain responses relate to individual differences. So we do see that. And some of the brain regions where we see more responsiveness are sensory cortical regions. So this is where the brain processes visual information or sound or touch, kind of at a very basic level. But then there are kind of more complex regions like the amygdala. So the amygdala, we often call our fight or flight region of the brain. So this is the area of the brain that tells you how important information is. And it can tell you whether or not it's a threat, but it's really just importance, whether that's bad importance or good importance. So we do see the amygdala reacting more, which tells us that for autistic people, there's something more important that is drawing their attention to these sensory stimuli. Yeah. And then we see differences in the thalamus, which is really important because I was talking to you about our sensory filtering system. So the thalamus is like the key to our sensory filtering system. If you imagine kind of the brain is like the skies with lots of airplanes flying around, the thalamus is kind of the airport where air traffic control is. So every sensory signal goes through the thalamus, and the thalamus, your air traffic control is directing it to where do you fly next, or should you stay on the ground and not fly yet? So how much sensory signal gets through, how much sensory signal continues to be processed, how much attention do we pay to these sensory signals, all of that is going through the thalamus. And the thalamus talks to our cortex. The cortex is the area of the brain that's kind of like our higher level, like very human, like thinking part of the brain. That helps us regulate our responses, our behavior, our emotions, and kind of the way the thalamus and the cortex talk to each other really helps our brain decide, should we ignore this sensory information? Should we stop thinking about it, or should we keep thinking about it?
Mm-hmm.
And too much of either way is not great. So what we actually want is a lot of flexibility and change. Kind of like with air traffic control, right? You don't want to ground all the planes and you don't want all the planes in the air at the same time, right? You have to be
Mm-hmm.
really flexible and kind of adapting to make sure everybody takes off on their, turn and everything's running smoothly. It's in this very complicated system. And we rarely stay in the same exact sensory environment for a long time. Something is always changing, even if we don't notice it, even if it's just a shadow coming through or a slightly different background noise. Um, and so we want to have these really flexible responses that really adapt as our environment changes. And we think that's one of the challenges that autistic people are having, is that they kind of get stuck in one state or another state. Um, and they're not kind of fine tuning these thalamus to cortex interactions to adapt really quickly and effectively to new signals coming in.
That makes a lot of sense. I mean, just when we're looking at how much of being able to understand and read an environment, how to be able to filter out relevant information, to be able to learn, whether it's even kind of that developmental stage where everything becomes so important, which sounds are important for me right now to be able to be responsive to. Adult relationships are so complicated. You look at our society right now, I don't know who understands what's happening in the world around us at the moment. Imagine if you have all these filters that
Yeah.
make it even harder. So when I'm thinking about coordinated care and I'm thinking about, how to be able to create the best interventions for empowerment of individuals, if I'm not tackling this barrier or this challenge first, and I'm not embedding it into everything I'm doing, I feel like I'm leaving somebody without a core skill set that will
Yes.
always create challenges. Is that the right way to think through this?
Yeah, I mean, I think that you're touching on a really key point. So if you remember earlier, I was saying that like we think by age 8 to 10, typically developing kids kind of have this down, for the most part. This is a more basic skill that your brain is developing. So what that means is as they go into adolescence, that's kind of done. I mean, again, I'm oversimplifying, but like really, like the foundation is set. And then you think about how complex adolescence is with like how much more complicated friendships get and how much harder school gets. And you're just navigating this, more complicated environment. So what we know for autistic kids is they haven't developed that basic sensory regulation yet. So they're getting then thrown into this more complicated adolescent environment without that sensory foundation. And they're trying to manage all of this at the same time. They're trying to filter these sensory signals and manage, why is my, this friend drama kind of coming up right now for me? Or, why is my teacher suddenly giving me 10 times as much work as I had last year? So I think you're absolutely right that if you don't have that foundation, as life gets more complicated and harder, you're just then trying to deal with more and more and more things all at the same time.
Absolutely. And I mean, when we're looking at adolescence, when we're looking at adulthood and that high level of mental health challenges, whether it's
Yes.
anxiety, depression, all of these seem to stem from a lot of what you're describing right now with, I might not have developed all the right skills for being able to navigate the environment and to be able to filter out irrelevant information or to be able to quiet the noise. And when you think of anxiety in general, it's oftentimes I can't quiet the noise. I can't get kind of that real comfort with what's happening right now and get myself so that I'm coping and I'm at ease. And now I think without that skill set developing during those core stages, I could
Yeah.
see a big uh, comorbidity occurring with those particular diagnoses of anxiety, depression, everything that would be coming after. Are you seeing that in some of the participants of your research where, some of the mental health issues that you might see later in life are creeping in earlier for any of the autistic individuals?
Yeah, so you're absolutely right. So this type of sensory overreactivity is highly related to having more mental health challenges, particularly anxiety. And you know, I don't think that's such an interesting question. The research hasn't been done to see if like it's happening earlier developmentally or not. All I can tell you is it's highly correlated, and it's highly correlated even in kids.
Mhm.
So certainly you see kids having more anxiety if they have sensory overreactivity as well. Um, I think that this developmental question, we keep coming back to this, what ages are things happening? How do they develop? It's so important because everybody is different, right? So, some people can have sensory differences and not develop anxiety, or some people might be at risk for developing anxiety in childhood, but other people are at risk for developing it in early adulthood. Or some people are more at risk for those sensory differences really impacting their executive function, like their ability to plan, to do homework, to um, kind of think through how their routine and how their day is going to go and how to solve problems. So I think we need to understand, this is kind of where my research is focused right now, is how do we understand how to predict who's going to have challenges and when are those challenges going to happen? And does that suggest different types of treatment or intervention or supports for different kinds of people?
Is that predictive analysis coming out of your research? Is it kind of looking at, and I don't know how to kind of position this, but would it be, I'm looking at common characteristics of somebody and I'm trying to figure out what are those core deficits that I might have seen earlier in their life and trying to map it back? Or is it a matter of I'm using the information from earlier studies to look at how the brain developed to what I'm seeing now in adolescence?
Yeah, I mean, I think that it speaks to the importance of what we call longitudinal studies. So longitudinal studies are when we follow the same group of kids over a period of time. And I think to get the kinds of predictions you're talking about, you need to have these kinds of studies. And they're very rare in sensory processing. Most autism longitudinal studies to date have focused on how things like IQ or verbal skills or kind of daily living skills, how those predict outcomes and development. Those are really important.
Hmm.
But it's not the only important thing. It doesn't predict everything. And there's very little work right now on how sensory processing differences predict development and predict outcomes. So that is what our lab does right now. We are following a group of adolescents from kind of late childhood through adolescence. And then if we're lucky enough to get more funding into early adulthood, um, so then we can actually track, okay, from this sort of 8 to 12-year-old period, what did they look like? What kind
Hmm.
of sensory challenges did they have? Did they have any mental health challenges yet? Do they have challenges with executive function, with emotion regulation? And then what happens when they're 15? What happens when they're 17? How does this affect school? How does it affect friendships? How does it affect their ability to kind of develop more independence and where they go as young adults? So yeah,
Absolutely.
we do need these longitudinal studies so we can sort of follow kids over time.
And a lot of times when you're talking about research, there's that immediate impact of a research study, which might give,
Yeah.
the skill sets or the understanding or the knowledge or whatever comes out of that, and it has an immediate impact. Longitudinal studies oftentimes have a pay it forward sort
Yeah.
of thought process to it, but without those, it's so hard to move the sciences along, so hard to move treatment paradigms along. So, what is it that you, when you're talking with families and you're talking about building a participation network for the research, what is it that you try and convey to them as far as, this is what it could bring about. This is where I hope all this research could lend itself in a few years' time.
Yeah. I mean, our participants have been so fantastic. We have so many families who are really in it, not for they know that the benefit to themselves is limited, but they're really, really hopeful that kind of the benefit to future generations or to kind of society as a whole will come around eventually. And we do try to strike a balance between more immediate science, more immediate results that we can get out sooner. And then obviously the longitudinal results take a really long period of time. But in addition to being a researcher, I also work as a clinician. And I talk to a lot of parents of autistic kids. And I know one of the things that is kind of looming large in their mind is what is going to happen when my kid grows up. That's really causes a lot of anxiety and stress for parents. There's a lot of uncertainty. Am I going to have to take care of my child forever? Are they going to be independent? Will they go to college? Will they get a job? Will they be able to live on their own? And I think parents want to know what they can do to help their child kind of develop successfully and have some certainty. They also want their kids to be happy. They're really interested in quality of life as a young adult. It's not all about academic achievement or independence, but just, will my kid be happy? And so I think as parents are putting maybe their 8-year-olds, 10-year-olds, 12-year-olds into these longitudinal studies, they know that we are trying to answer the same questions that are kind of burning in their minds of how are these kids going to grow up? What kind of supports do they need as they grow up? I think that we are trying more and more to encourage parents to start thinking about this earlier. As your child's just 12, 13, just entering their teens, that's the time to start thinking about this transition to adulthood, even though it might feel really early.
Yeah.
But the foundation for the skills, for the independent skills, for how do you seek happiness in your life? And how do you have relationships, or how do you kind of manage day-to-day life? They're skills that we need to start teaching kids much earlier than adulthood. So I think the point is that parents are already thinking about these things at this age, and they want to know what to do. And we don't have great answers for them yet. And I think the parents I've talked to are really motivated to kind of find answers to these questions.
Yeah, and I think one thing that immediately lends itself is that I feel like when you look at clinical treatment, and historically, it used to work in so many silos. And the more that we can educate families, educate other practitioners, the more we can start to benefit from being able to utilize the knowledge that's coming out of research that might not have been in your field initially, and that you're able to embed it into a coordinated treatment so that you're taking advantage of all this valuable information, which helps the child, helps the family to navigate the world around them, and be happy. Like you said, is that's if you ask the number one goal for almost all parents. So I just want my child to be happy and to live their best life. How do you get there? It's always going to be different, but understanding the knowledge is so important. So where do you see the research evolving in the future? Right now, I feel like we're still trying to get that core built, that really good understanding built, which takes money, takes time. But from that, more questions are going to start coming out of this, and more research is going to start branching off of these initial studies. Where do you see it evolving over the next decade?
I think a lot of parents are still in a place of fear of, as soon as my child turns 18, there's not going to be any services for them, let alone integrate, lovely integrated comprehensive services. So that again is the benefit of starting early right now. I'm not saying that's not good. We need more support for adults, but in the system we are currently in, starting around 12 or 13 means that you're still in a system of school support, of regional center, or kind of other, depending on what state you're in, kind of this developmental disability focused support. These are things that are there still when kids are 12 or 13 that very unfortunately sometimes just drop away when they get older. So I think it depends a lot on the family and a lot on the kid. Different families are thinking about totally different things, depending on sort of what their child's functioning level is, what their child likes and dislikes, and what their challenges and strengths are. I do see a lot of the time parents really worried about how their child is doing in school, and whether their child will be able to go to college. And that can sometimes really push to the front of everybody's attention without really thinking through, well, let's say we get them to college, how are they going to live in a dorm? How are they going to, navigate those social relationships? How are they going to deal with the sensory experiences of being in college? How are they going to, go to the dining hall and get their own food for themselves? So, like you said, it has to be comprehensive. If we just focus on one thing, like, getting them, making sure that they're getting tutoring, for example, so they can do well in school and apply to college, we might be missing these other pieces that are going to be really important to whether or not they can succeed once they get there.
And it does. I think with every component of raising a child, whether that's a child who's autistic or a child who is not, it takes a village. It takes so many component pieces of the community to really do a good job. And it just is more unique when you have different challenges. Where can folks go to learn about your work and the study that you are currently involved in, especially if they want to participate in the next round as more funding becomes available?
Yeah. Well, we do have openings for participation right now, so that would be fantastic. In fact, we're talking about the variability, how different kids are and their different needs. And actually, one of our current studies speaks to that. We have found that it is really challenging for some kids to sit still in an MRI, especially kids who might have lower cognitive or verbal skills. And so we do have a study right now where we are working really hard to look at heart rate measures of sensory overresponsivity, because that means we can study this both longitudinally, we can study treatments and supports without having to put kids in an MRI scanner. So that means we have a current study right now where we are recruiting kids 7 to 15, and they can, we're really recruiting a wide range of kids all across the spectrum. They do need to be able to come into UCLA in Los Angeles, but the brain scan is optional. You don't need to do that part. And you can find more information about our studies and how to participate at scanlab.semel.ucla.edu. And there's lots of information there on how to contact us and how to participate. We are also actually have a very accessible study where you can be anywhere in the country for 4 to 5-year-olds with autism. And so there we're looking at the impact of sensory reactivity and sensory differences on the development of early social skills, like how you can see emotions in other people. And that's all over Zoom, so you can participate in that from anywhere.
I appreciate the work that you all are doing, and I think these questions are so relevant for being able to kind of really understand the whole dynamic and even the starting point to what actually is contributing to some of these challenges with being able to really understand and filter out the information in the environment. So I do encourage families to participate if they're able, not only for what it will do for the next generation of children, but also just understanding your own child better is such a powerful thing. It's the more that you know about those that are a core piece of your life becomes that much more enriched. And it's the same thing with your child. If they're autistic, you want to know how they're experiencing the world around them. So it's such a valuable study. Dr. Green, thank you so much for coming on our podcast today and sharing your knowledge and your experience. And I will be following the study as well, because I'm really looking forward to hearing kind of the results and what we can learn from that.
Thank you so much. It's been a pleasure to be on here, and your questions were fantastic. So thank you.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.